Casey said, welcome, welcome. Thanks for joining us tonight for Alphabet Soup, Advanced Nursing Degrees, the why, what, and how. As Casey mentioned, my name is Nicole, and I head up community over at Trusted Health. If you're not familiar with Trusted, we are the place for the modern nurse. That means we place nurses in all sorts of positions across the United States for travel nursing opportunities. We also have a plethora of resources to help you with your career and beyond, and whether that's blog posts or podcasts or articles or events like this. So we're really happy that you're here, and we're really excited to share what we're going to walk through tonight.
Thank you so much for having me.
Yeah, I was gonna say, I'm gonna pass it over to Ashley, but if you
oh my gosh, I know. Why did I hear that already?
That's okay. We're all good. A couple things before I give it to Ashley. Any questions you have, we love questions. Please pop them into the Zoom chat, and Casey will grab them and float them up to Ashley so she can focus on all of her amazing content. This is your chance to listen, learn, and connect. We know that advanced nursing degrees are very complicated, but they're also really, really important. So take it all in, ask the questions that you want to, and hopefully you'll find some clarity in the wonderful, wild world of this alphabet soup that we're about to dive into. And a couple things on the agenda, and then I promise I'm going to give it to Ashley. Number one, you're going to meet Ashley. Number two, we're going to go through alphabet soup. 3, advanced practice roles. 4, choosing a program. 5, the application process. 6, funding, get that money so you can pay for your education, and then some Q&A at the end. And so without further ado, as I promised, I'm going to hand it over to the amazing Ashley Sayles.
All right. Hi, everyone. So I'm Ashley. I'm a pediatric nurse practitioner and former pediatric ICU nurse and travel PICU nurse. You can see all my stats right there. I'm currently in Baltimore, Maryland. I've been living here for the past 7 years. Wow. And I'm super excited to talk about this with you guys tonight. I get so many questions about advanced practice nursing or just like things other than bedside nursing that you can get into. And it can be really confusing trying to figure out where you fit into all of that. So I'm really excited to be here about that, to talk about that. And my fun fact is I tap dance. I tap dance. For fun. I've been doing it since I was about maybe like 4 or 5. So it's like decades in the game. I'm pretty good, but I'm not going to tap for you tonight. So let's just hop right into everything. When you're trying to figure out what you want to do, aside from bedside nursing, which is usually where we all start off as some kind of like bedside nursing or maybe even like some kind of outpatient nursing. But for the most part, we all start there. And when you're deciding where else you want to go, it's really important to figure out why you want to go. Why is it you want to leave bedside nursing? You went and got a BSN for a reason. Why is it that you want to leave that? Why is it that you want to do something different? And once you figure that out, it's really going to help you decide or filter out a lot of the like dozens of options there are for you as a nurse to pursue your career. So there's a good quote right here. It's, if you really want to do something, you'll find a way. If you don't, you'll find an excuse. And if you are not like super passionate or like really have some good reason behind, I hate my job for going back to school or whatever the case may be, you'll find an excuse why you shouldn't do it or why not do it today or whatever the case is. So definitely want to be passionate about it. Know your why. So now we're just going to hop right into the alphabet soup, talking about degrees, licenses, certifications, and all that good stuff. So the first thing you want to get into are the 4 types of advanced practice nursing roles that there are. So there are plenty of things that you can do as a nurse, but to be considered an advanced practice nurse, you should fall under one of these 4 categories. So that's a nurse, CNS or clinical nurse specialist, a nurse practitioner, midwife, or CRNA. Pretty much all of them give you prescriptive authority, which means that you can write prescriptions for medications for patients. Except for the clinical nurse specialist, there are a few places that you may be able to write prescriptions for certain things. For example, if you are a wound care clinical nurse specialist, you may be able to write prescriptions for certain supplies, certain types of specialty, dressings and things like that. But aside from that, clinical nurse specialists don't really function in that role. Nurse practitioners, I feel like we're all pretty well versed on the nurse practitioner role, but we usually can function in place of or in collaboration with a physician or a medical doctor, depending on the state, your prescriptive authority or your scope of practice, what you're allowed to do as a nurse practitioner will vary. I have little headers where for licensure, you can see that there are two different acronyms there. APRN and CRNP are two of the more common ones. APRN is Advanced Practice Registered Nurse. CRNP is Certified Registered Nurse Practitioner. Depending on the state that you live in is what's going to dictate what your acronym will be. The boards of nursing decide what their acronym is going to be for each state. So when you see these letters after someone's name, just know that it only means that they are an NP or some type of advanced practice registered nurse in that state. Doesn't necessarily break down what type of NP or what it is that they do specifically. The board certifications get a little bit more detailed as to what it is that each nurse practitioner does. The board certification is what we know as like the board exam. So for an RN, you take the NCLEX, that's your board certification. For nurse practitioners, you take the board certification exam for the type of nurse practitioner program that you completed. So if it's family nurse practitioner, if it's pediatric, if it's women's health, adult gerontological, or psychiatric mental health, those are the different letters you may see after someone's name, and that's what they all mean. So you can jot them down, start Googling later and figuring out what they all are. A lot of them are pretty, you could probably figure them out if you just really look, but a lot of them can be a little confusing. So just make sure you jot them down if it's something you're interested in. And this will be recorded too, so you can look back too. Nurse midwife and nurse anesthetist, we'll talk a little bit more about those later, but we pretty much know what they do. So yeah, we'll get into them specifically a little bit later. So then when you're talking about education now, these are the different levels of education you can get for different advanced practice nursing roles. So there's either the MSN, the DNP, or the PhD. MSN is your master's. DNP and PhD are both doctoral degrees with a little bit different criteria required for graduation. Right now, for master's degrees, you can, there's some NP, midwifery, and CRNA programs that are MSN, but not many left. A lot of them have transitioned to the DNP. A lot of CNS programs are still masters, even though there are a lot of doctoral ones now as well. And within that same breath, as they are transitioning a lot of these advanced practice roles to doctoral degrees from masters, there are also a lot of entry level RN programs that are master's degree programs too. So where I went, Johns Hopkins, I did a BSN program, but they don't offer BSNs anymore. They only offer MSNs. So you'll have to come with a degree in another field before you can even become a nurse at certain schools now. So just make sure you're checking those websites and seeing what their criteria are. So for the DNP, the biggest difference between the DNP and a PhD, besides graduation requirements, is that PhD programs very, very rarely, I've never heard of a PhD program that can, that trains you to be some type of advanced practice registered nurse. So there aren't any PhD nurse practitioner programs or PhD midwifery programs or things like that. Only DNP, Doctor of Nursing Practice. PhD is usually for non-clinical nurses who are getting into the education and research realms. you can have a DNP PhD, which is like both degrees. But again, for advanced practice, DNP is usually the degree you're looking for. Also, I have listed here some certificate programs. So there are some specialty certificates, like maybe like an HIV or infectious disease certificate, pediatric critical care certificate, or things like that, that show that you have advanced knowledge in a specific patient care population or specific area of medicine, but doesn't necessarily grant you any rights to do anything outside of your nursing scope. So, wouldn't be writing prescriptions or things like that in most cases, unless you are already a nurse practitioner or, midwife, CRNA, thing like that. But if you're an RN who gets like a infectious disease certificate, you wouldn't be able to start, like treating HIV patients. Like you'd still have to work with a provider, but you'll just have like advanced knowledge in that and maybe be able to be hired in certain places where other RNs wouldn't. So those are some education routes, or the education routes that there are for advanced practice nursing. So when you're deciding on a role, it can be really hard because in nursing, there's so many options. So I broke it down into like 3 easy questions to ask yourself to help you decide what you want to do. So what patient population do you want to work with, right? Like, what is it? Who do you want to work with? Do you want to work with older adults, kids, patients with certain diseases? Like, who is it? And then what is it that you want to do for that patient population? Do you want to provide care? Do you want to research them? Do you want to, do home care with them? Do you what is it that you want to do? And then once you, really and honestly think about who it is that you want to work with and what it is you want to do for them, find what role that already exists that closely aligns with your goal. Okay, so if you want to provide care, but don't necessarily want to prescribe medications, you just are really interested in a super specific field, maybe a clinical nurse specialist role would be a good option for you. If writing prescriptions and managing patients independently is something really important to you, then nurse practitioner might be a good role for you. If you really like anesthesia, like ORs, like quiet, like kind of serene, complex patients, CRNAs for you, so you like birthing babies and be a midwife. So just think about what already exists. And sometimes what you want to do may not already exist, but there's something that can get you a little bit closer. And we'll talk about some of those roles later on. But there's a lot of things that you can do in nursing. And honestly, a lot of roles that currently exist in nursing were made up by someone that saw a need. So that's how nurse practitioners started. That's how CRNA started. So you might be the person that starts the new thing. So don't be afraid. If you see a need and there's something you feel like you could offer, don't be afraid to explore it. Okay, so yeah, any questions? Were there any questions?
Thanks a lot, Ashley. I've already learned so much. I really like that last part about forging your own path. So it looks like we already have one question in the chat. Crystal asked, what are some books or resources you can access at home to help you study to be a family nurse practitioner?
Books and resources. That is a great question. I know for if you're studying for the board exam, there are review courses like the Fitzgerald review is a good one. I'm not sure of any others, but I've heard of Fitzgerald. Also, checking out Amazon for like their review books. That's where I got my Pediatric NP book from. So if you just like check them out, see if they have like a Q&A book or something like that, like a certification review book, that should really be helpful for you. I'm not too versed on family NP things and offerings since I did pediatric, but Amazon is always a good friend.
Right, awesome. If anyone else has any questions, just throw them in the chat and I will ask them. All right, here we have one from Joseph. I'm a new grad and my goal is to be a CRNA. What do you think I need to do first as my first step?
So one thing I know about CRNA programs are, as far as requirements, is that you need to be working in ICU for a minimum amount of time. So I always say, if you have a goal and you know you want to be doing something, you should definitely be like stalking these schools' websites, their admissions criteria, and like what you need to be doing in order to be a strong applicant. One thing for CRNA schools that I know for sure is that they are very competitive as far as admission. So not only do you want to have everything in your application, you want it to be like strong. So I would start from now. If you know that's your goal, start looking at some CRNA programs that you're interested in attending. Go to their website and see what they need and what they want from you guys, and start working on it from now. You stay ready. You don't have to get ready.
Especially if they make you take any extra courses too to go ahead and
exactly. Yeah. And GRE sometimes and things like that. So you don't want to be blindsided like day of, like, oh my gosh, I was supposed to take a test and I didn't even know.
Let's see. Rebecca asked, I would definitely want to be a PNP of some sort, but not sure AC or PC. I don't want to work in the hospital, but would be interested in specialty clinics. Do I need an AC program for that?
Oh, good question. So let me just clarify. AC is acute care and PC is primary care, for those who may not know what that means. So that's a loaded question. Technically, to work in a if it's like an outpatient specialty clinic aligned with a hospital, you can more than likely work with a primary care NP certification. That was my first NP job ever, was doing that with a surgery service. My role did kind of cross over into inpatient a little bit here and there, maybe like 10%, but for the most part, I was outpatient. So it can be done with primary care. However, if I would check in with like local like children's hospitals and oh my gosh, sorry about that. Local children's hospitals and things like that, to see if what their hiring practices are like, maybe some nurse practitioners that you may know, see if you know what it's like in your area. Because as I said, with nursing, they kind of like tweak and twist things around to make whatever they need work. So while things may be okay or kosher where, I am, it may not where you are. So definitely want to check and see what the practices are in your area.
All right. Thank you for that. Let's see. David asked, any advice on someone who is an FNP student who hypothetically wants to eventually become a CRNA in the future?
That is a great question. Advice, you must really like school. I would say, if you are hoping to use any of your graduate credits from your FNP studies towards your CRNA studies, then sooner rather than later will probably be in your best interest, because credits start to go bad with some of these grad programs after like 5 to 10 years. So that would be the best advice I have. I have no idea what that process would be like. I don't know anyone that's done it to even reference, but yeah, definitely sooner rather than later. It's the only thing I could say.
All right, perfect. Let's see. I think we have time for another question before we move on.
Yeah.
This is a great one. This is very specific to you. Annalise asked, what's a day like for a PNP?
Oh, girl, you should watch my takeover. No, I'm kidding. So typical day for me, I pretty much function in the role of a pediatrician. So I see kids from 8 to 4, with a lunch hour from 12 to 1 for their well-child checkups and their sick visits for their sniffles and sneezes and rashes. When I'm not not doing that, I am reviewing consult notes and labs and things for my patients that we're seeing other providers, or got some lab tests drawn. I talk on the phone a lot. I talk parents off the ledge a lot, especially right now with COVID. Yeah, a lot of the phone. But yeah, that's pretty much day to day. Of course, every day is different, but I think that's a good summary.
If you follow Ashley on Instagram, you'll be able to see some of her really cute patients.
Oh yeah, oh yeah.
So I recommend that if you want to look more into what a day is like for a PNP.
Right.
I'll do this one last question and then we'll move on.
Okay.
Taylor asked, I believe you said schools are phasing out of the master's NP programs. How to choose which to do? Is there a difference in pay once out of school?
Oh, great question. Oh, I love this question. So far, what I have noticed, no. I cannot speak to what will happen in the future, but just looking at how things have gone in the past, I don't think it will be an issue for a very, 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 very long time. Right now, master's and doctoral prepared nurse practitioners are making the same. I haven't seen any doctoral NPs that are being picked for a position or something over someone else because they have a master's. It's usually based on your experience overall and things like that. I find that the degree didn't even really come up in any of my interviews on whether or not I did a master's or doctoral degree. A lot of the times when you're interviewing, you're really interviewing with medical staff, like a lot of the time, and they're not really interested in what degree you have. They just want to know that you're credentialed and can do the job. So right now, there's absolutely no pay difference, no hiring difference or anything like that. So I would say do what fits your budget and, you know, what makes sense for you. If you want to ask me what I would do right now, that was the program that was offered to me at the time. My program doesn't even exist anymore. If I were going back right now, I'd probably do a doctoral degree, just because that would be what was presented to me at this time. And that's just where it's going. So I like, just knowing me and never wanting to go back to school, I would probably just do it. But right now, I'm completely fine and don't have any immediate plans at all to go back to school to get that doctoral degree. So, yep, that's
All
that.
right. Awesome. Well, let's head on to the next section. Just everyone, so you're aware, I will try to ask these questions that we didn't get to later on in the event. I just want to make sure we have time to cover all the information.
All right, guys. So we're just gonna get into the main concept of each of the advanced practice roles. And this is in no way going to be exhaustive of everything that each role does or, you know, is able to do, but it's just going to be a brief summary. So you'll definitely have to keep doing your research. That is going to be like the theme of this whole talk, is doing your own research. I just want to guide your, you know, your Google search. So clinical nurse specialists. So they're basically the unit expert. They are really, really specialized in something, whether it be emergency medicine, whether it be diabetes, whether it be wound care, pediatric critical care. They usually live on a unit. There's some unit that's super specialized in your hospital, oncology, for example, something like that, where they kind of always are. They've been there forever, have probably been a nurse forever. And then they are usually used to help like implement protocols, procedures, and things like that. So if there's like some new machine that's coming out or something like that on your unit, they'll be the first one to test it out. They'll, you know, hold the in-service to make sure everyone knows how to use it. They'll be the one that's, you know, if there's some need on your unit, you're convinced that you guys need more than 2 bladder scanners and you need help with like, you know, proving that, this will be the person to help you. Be like, look, we're having to bladder scan like 65 times a shift. We can't have 2, you know, things like that. And they help kind of advocate for your unit and your patient, your patient population's needs to higher ups, and like, within the hospital system. Last little point here, may provide some insight on complex cases or minimal diagnostic and prescriptive authority. So that was kind of like that example with wound care nurses. Sometimes they'll be diagnosing and prescribing things for different stage, like, pressure ulcers and things like that. Even in some states, like the diabetes and CNS, for example, may be able to, modify a insulin regimen or something under the, scope or with a cosign of a physician, something like that. So look and see what a clinical nurse specialist can do in your area, see if you know any of them and talk to them about what they do. This is probably the one role that changes the most, depending on where you are and what kind of situation you work in. So this is definitely going to be something that you want to network and find out someone who does this and know more about what they do. So a certified nurse midwife, one of the most specialized of the roles. So of course they're delivering babies. That's their thing. They'll do prenatal and postpartum checkups for women as well. They're usually reserved for relatively low risk expecting mothers that, don't have we don't anticipate needing some type of invasive or complicated care. They also do like well woman exams and things like that, like a gynecologist may do, pap smears and stuff like that, family planning, birth control, and those types of things. This nurse usually has worked as a labor and delivery nurse for some time before going back to school. Some midwife programs even require a certain amount of time working as labor and delivery nurse before you can apply. So make sure you're looking at those admissions requirements. But yeah, there's a lot of things that they can do outside of just delivering babies. If that's not, your jam that you want to do all the time, you may want to do more women's health type things, but want to have the option if you want to transition or something like that. Women's health NPs don't deliver babies. So if that's something that you want the option to do, that may be your deciding factor between the two. So yeah, that's pretty much midwife. Then there's a nurse practitioner. This is the most popular advanced practice role. There are more nurse practitioners than any other of the advanced practice roles. They pretty much are your, physician replacement. They can function in 99.9% of cases in the role of a physician. We're trained to do that, at least. We evaluate, interpret, diagnose, and treat illnesses. We are specialized. That's the one separate thing between physicians and nurse practitioners. Physicians graduate and can practice as a doctor on all people. They get certified in certain, or board certified in certain areas of medicine, but they can technically practice on all people, whereas nurse practitioners are only licensed to practice on the population that they are specialized in. So I can only take care of children. Children in my state are defined as birth through 21st birthday. So that is what I'm allowed to touch. There are, of course, some outliers. There are some other exemptions, but that's what I'm allowed to do. There are lots of specialties: pediatric, neonatal, geriatric, psychiatric, women's health, family. Some of them have acute and primary care subspecialties as well. A quarter of the states in the US currently allow full practice authority for nurse practitioners, meaning that everything that you have learned to do in school, you are allowed to do. With COVID, that number actually jumped. That wasn't that much before COVID. And that number is expected to go up in the coming years with some legislation passing. But I think COVID definitely put the battery in a lot of legislators' backs about, being serious about making sure people have access to care, and access means having more providers. So if that is something that you were thinking of doing but didn't like the idea of you not being able to fully practice, I know that's a deciding factor in where I live, period. I would definitely look out for coming legislation in your state. California was a big one, a huge one, for NPs to get full practice in. So yeah, they're definitely, even the big states are changing. So that's a nurse practitioner. And then the nurse anesthetist is, they're all things anesthesia, sedation, and pain control. So they replace an anesthesiologist to provide sedation and pain control or nerve blocking in patients. So the one thing with them, you must work in an ICU that is not the neonatal ICU, but most programs will accept pediatric ICU, FYI, for a period of time before applying. Some CRNAs work outside of the operating room as well on pain management teams. When you specialize in anesthesia, you're also like very familiar, obviously, with the pain control medication. So sometimes you'll find them working in chronic pain clinics or consulting with inpatient chronic pain or long-term rehabilitative patients, like, long bone breaks and things like that. The highest paid nurses in the United States are CRNAs. So if money talks to you, you need to be call in CRNA. But it is the big thing with CRNAs, especially going back to school, it is a commitment. It is 3 years long, and most, if not all, CRNA programs contractually ban you from working during the time that you're in school. So if having funds while you're in school is something that's important to you, you may have to think about that. Loans are pretty much every CRNA student story, as far as I know, because of that not being able to work clause. So if loans are out of the question for you, something to consider. But yeah, that's CRNA school and CRNA overall. So other nursing specialties. So I have this very, very long list of specialties. And honestly, this is not even everything that you can do in other, in terms of nursing. But there are a lot of things that you can do outside of being like a bedside nurse that don't require you going back to school and are not technically advanced practice, but can get you away from the bedside and get you to something really specialized that you're really interested in. Some of them, while they may not require like a formal degree program, they may have some type of certification course or program that you need to complete that may be like 6 months or something before you can be certified to do this thing. I just want to be clear that the term advanced practice, it is used to describe nurses that are allowed to do something, or let me not say allowed, licensed and certified to do something that is greater than the standard nursing scope of practice. So like for nurse practitioners, you can prescribe, you can diagnose and things like that that are outside of the nursing scope. In all of these specialties, there's nothing that you are doing here, for the most part, that is outside of your nursing scope. So that's the big difference here. Nursing informatics has been something that has been like buzzed around lately. And a lot of people are interested in it. Some people are not even sure what they really are. So I just want to highlight it really quick. So an informatics nurse, or a nurse informatics clinician, other titles they may have, is a nurse that will help with implementing technology or some type of software, hardware, even in a healthcare setting in some way. So informatics nurses are usually the ones who are a part of helping to build the electronic health record that your hospital system uses. So when your hospital switched over to Epic, which I'm sure was a nightmare, there was an informatics nurse who was responsible for that. So if you want to be that person, no, I'm kidding. But they help integrate technology and healthcare from the nursing's perspective. So thinking things like type 1 diabetics who use like glucose monitors and insulin pumps and things like that. They will work with like technology companies and things like that to help fine tune those products, or they can work with a hospital to help, make sure that the patient portal is user friendly for both nurses and patients, things like that. So there's a lot of different things that they can do, but it is pretty interesting, and they're used a lot more in recent times as everything becomes very digital and technological. They're becoming a lot more useful. So that may be something, if you're interested in techie stuff, you might want to do. Okay, so if we decided on a path and your path involves school, let's apply. It is a scary process, but it can be done. I think it will be okay. So the application requirements all vary by school. So as I've been saying throughout this whole chat, make sure you're checking the school's websites. Check all the time and check frequently, because sometimes if you may look for one application cycle, maybe change the requirements for the next application cycle, you're taking a class you don't even need anymore. Like, make sure you're regularly checking their websites. Most of them require transcripts, resume or CV, some type of essay, some type of rec letter, maybe interview. Make sure you check out those prerequisite courses, how recently they need to have been completed. Like I said, a lot of them will have that 5 to 10 year expiration of your previous courses. GRE is a requirement for a lot of these programs now, especially since they're going DNP. A lot of COVID has changed that for some admissions cycles, just because there was such a hard time getting people into testing centers and things like that, similar to the SATs right now with undergrads. So make sure you're checking. And if the GRE wasn't something you're looking forward to, now might be your time to apply because they're like not probably, requiring it right now. So anyway, I just want to talk about personal statements really, really, really quick. Strong personal statements get acceptance letters. Strong personal statements get acceptance letters. Everyone's application is a series of data, right? Of course, grades are important. Of course, they want to make sure you worked at the top institution and all that great stuff. But what schools are really, really what's important to a school when they want to admit someone is, one, are you going to finish that program? And two, are you going to put the school on the map? That's basically what they want to know. So are you going to come to the school and leave and reflect so greatly on the school with all of the things that you're going to achieve as a nurse practitioner or as a nurse midwife? So in that personal statement, you need to talk about how you're going to change the world with this degree. Don't be afraid to be all dreamy. I talked about starting this beautiful asthma camp that was in the middle of the mountains, and they would get fresh air and they'd be able to breathe and all kinds of nonsense. But it was something I'd really love to do, but they want to know that you're dreaming big. Okay. So make sure you're thinking about that and think about what your why is. When you thought about those 3 questions and what made you decide to go back to school and put yourself through this again, talk about that. There has to have been some amount of passion behind it. And if you really don't have anything passionate to say, maybe you should even rethink the application, because it's hard. Okay. It's hard. I'll be honest. And you don't want to get into it if you're not passionate, because even I was the most passionate about it towards the end. And even I was just like, wow, this is a lot. So you want to be really, really passionate. And that's what the schools want to be able to sense that through that personal statement. So make it strong. And then how you choose a school. This is another hot topic that there's a lot of chitter chatter about. Above all else, make sure the school's accredited to do what they're saying they're doing. Let's just start there. So if they're offering you a family nurse practitioner program, make sure you go to the board certification website for the family nurse practitioner board exams and find that school's name on their website just before anything else. Then research that what the school is offering and their reviews, just like anything else. You Google that school like there's no tomorrow. You want to hear, Google whatever school bad reviews. Like you want to hear the worst of it. Like what's someone's worst experience? You want to know what are they really about? You know, because if you go on their website, everything looks beautiful and it's always a beautiful fall day, and you know, with the super diverse, you know, not patients, oh my God, you know, students that are walking across, and it's so beautiful. So you want to know what it's really like. Are you some questions to think about, especially for nurse practitioner programs? Are students supported in finding clinical rotations? That's like the biggest thing that you will hear about nurse practitioners going back to school right now, is trying to secure a clinical rotation. Does the program find them for you, or are you responsible for finding them yourself? And as easy as it sounds to be like, oh yeah, I'm just gonna ask so-and-so and so-and-so and so-and-so, I'll be fine. You'll find out very quickly how not fine it can be. I've had friends who have had to delay graduation and things like that, especially with COVID, because they weren't able to secure clinical sites, or sites that they did secure fell through. So make sure that this, you know, you're really thinking about that. Do they offer career advising for new graduates? Are there, is there any kind of like job placement assistance? Do they have job fairs, or certain institutions that they partner with that, you know, they kind of funnel their students to? If finding a job right after school is important for you, that's something you should be thinking about. Online schools versus traditional. So especially now with COVID, I know a lot more people are thinking about online programs. So, you know, one, they're cheaper usually, and two, pretty much everything is online right now, regardless of if it's a truly online program or not. But typically online programs do tend to be a little more hands-off with their students, don't really offer as much assistance. It's really more kind of go at your own pace. So if a structured program, or, you know, having, you know, schedule kind of laid out for you, and everything's kind of like dictated for you, something you like, then online may not be for you. If you need to be able to do things at your own pace, if you need to take 3 semesters off, if, you know, whatever, online may be more for you because it's a little more flexible. So just kind of looking into it, asking people that you know that have done either or, what their, you know, opinions are of both. Of course, there's advantages and disadvantages to all of it. And of course, aside from all, above all else, after you found out that they were accredited, make sure you can pay for it. What can you afford to invest in the program, because you don't want to overexert yourself, but you still want to make sure you're getting your money's worth. So that's how you choose. And then, oh yeah, I forgot I was going to talk about this a little more. The online programs. So yeah, again, with the online programs, when I talk about securing that preceptor, things like that, the online programs can be really, really tough. They are not meant for the faint of heart. I don't know if I personally would have survived in an online program. I'm kind of needy as a student. I like things handed to me. So me finding an you know, preceptor probably wouldn't work for me, but they are definitely a lot less expensive than what I paid to go to school. They offer a lot more flexibility and, you know, scheduling. I know with my program, if you didn't take a certain class by this semester, you had to wait a whole like 2 years for it to come back again in the right order. So, you know, sometimes they'll offer things a little more often since it's all online, and kind of go at your own pace. Student support and resources. So making sure that You know, does your online school offer like online database access? You know, those super expensive research journals and things that you need to be citing in all your papers. Does your school offer that? Or is that something that you're going to have to subscribe to yourself? Sometimes a lot of the bigger schools will already have like institutional access to those things. So just knowing that those are things you'll be needing and just making sure that all of those things will be provided for you. Those are questions to ask during like, you know, their little virtual open houses. What resources do you have available to students? You know, how do you support students? Who do students reach out to if they are, you know, struggling with whatever? You want to know that those things are in place, especially now with COVID. You just want to know that you'll be supported in somewhere you're not kind of just left hung out to dry. Okay, so now how am I paying for it? I don't have a lot to say about this. There really aren't that many options for paying for school, in my opinion. Of course, there are loans, federal loans, for just to point out, are eligible for most, if not all, of the government sponsored loan repayment and forgiveness programs. A lot of the advanced practice roles qualify for these programs if you work in certain areas. So making sure you're looking to see what repayment options are available and what those requirements are in order for the loans to be eligible, and then find those loans if loans are what you're going to be doing, because that's what I did. Okay. Then there are grants. Lots of like professional organizations or state and federal sponsored programs are out there. There's the ever popular Nurse Corps. If you are a part of any of the professional organizations like the American Nurses Association or things like that, they may be able to offer some discounts on some things. I know the state of Maryland has a tax credit actually for nurse practitioner preceptors. So, you know, there's all kinds of things you can look into to find little ways to save or get some money. Of course, worst comes to worst, cash, credit, you know, there are some scholarships, but I find that when I was looking, at least a lot of the scholarships were more for undergraduate studies. Found a hard time finding a lot of scholarships for graduate studies. But I'm sure they're out there if you know, weren't like me and spent 3 minutes Googling and said, oh my God, there aren't any. So if you're a little more diligent than I was. And biggest thing is employer benefits. I use that a lot too. I would say I funded my education 50% employer benefits and 50% loans. My job was really awesome. Like they gave $15,000 a year for you to go back to school, as long as you went to their school. So I worked for Hopkins and I went to Hopkins. I was like, oh, all right, I'll do that. That works. And I also did my program really, really slow. So I could like make my 15,000 stretch more per year. So I kind of worked it out, but there is fine print. You have to, a lot of the times with the employer sponsored benefits, there's some type of like years of service after they pay. So make sure you read the fine print. A lot of times they're not just giving out free money just to give it. There's a catch. For every year of service I accepted, I had to pay back 2 years of, or every year of tuition, I had to pay back 2 years of service. So after a while, I stopped taking it because I was like, oh, I don't want to be here forever after I graduate. So just think about all of those things. A lot to consider. Take your time to think about it. The earlier you start thinking about it, the better you can plan for it. So if you're really thinking about it, start talking dollars now. All right, that's it. I'm done talking. So ask away.
I'm going to go back up. I think we have enough time to ask these earlier questions as well.
Yeah.
So, John asked, I'm torn between CRNA and NP specialized in orthopedics. Is the admission process more based on your GPA or experience/certifications?
I think for nurse practitioner, I think experience and kind of like career goals are more important. I know with CRNA, I know like GPA, they're very data based over with CRNA stuff. Just because those programs are so competitive, they usually accept like 10 to 15 people per class. I would think it may mean a little bit more. But with that being said, I have never applied to CRNA school. So this is just me, giving you a nice educated guess, but I definitely reach out to some CRNAs that or even speak to some admissions officers in some of the CRNA schools and see if they have any perspective. Hope that was helpful.
Awesome. Thanks, Ashley. Let's see. Joseph asked, what other leadership functions can I do as a new grad? I researched that CRNA programs are more concerned and interested in the clinical leadership involvement. Thank you.
Leadership as a new grad, I would say it really depends on your unit's kind of like structure. But if your unit has like committees or I don't know, like interest groups or something, if there's some type of like extra thing you can be doing, I'd find my way into that so that you can, I guess, have a little bit more to put on your resume. Aside from your like nursing duties, you can add that you're part of, the scheduling committee or whatever. And that may even put you a little bit more in the front running of becoming like a charge nurse or some other type of leader on your unit. So I would just say volunteer for everything that they offer and kind of make your presence known. And that's usually how you stand out and get into those leadership roles.
Absolutely. Yeah. You can even just ask your nursing manager too, like what opportunities are available. How can I get involved?
Exactly.
That's what I did as a new grad.
Yeah.
Crystal asked, what is the benefit of a doctoral degree if it does not pay different or affect the hiring process?
It's a terminal degree. You get a lot more immersion in research and you just spend a lot more time learning leadership things and again research, which is really big in medicine. Right now, especially with technology like we discussed, there's a lot of innovation and stuff like that going on. So it just kind of puts you, I guess, in a better position to be in I don't know, part of the innovative process. I have no clue. I don't know. As I said, I'm not going back to school, so I clearly don't see a reason good enough to go back. But yeah, it's definitely very research based. You don't get any more like advanced practice immersion than you did in the master's program. All the extra classes you take are all research based. So that's something you should know.
All right. So just a note, guys, Courtney Caulfield, she dropped her email in the chat and she's also on Twitter. She is a nurse executive leader at Kaiser.
Nice.
Great resource. She said that if you guys have any questions regarding professional certifications in leadership or DNP, feel free to reach out to her. She's worked with us before and she's absolutely amazing. So
that's so awesome. Thank you for that.
Yeah, she's awesome. I had to leave early, but that's a great resource for any of you all out there. Crystal asked, any suggestions on how to improve opportunities to meet and network with other NPs, groups or organizations, etc.?
Oh, with COVID, that is just such a hard question right now because I would have so many answers for you. I would say joining some of the organizations. So as I said, the NPs, they're pretty broken off into their specialties. So if you're pediatric, there's the Pediatric NP Association, acute family, adult and stuff like that. So or the American Academy of NPs, that's kind of like the broad one for all of us. So you can join the organization as a student. It's usually cheaper as a student too. And that way you can probably be invited to their virtual events. and whatever like mixers and stuff they're doing right now, and just like what just happened, catch an email in a chat or something and network. I think right now with COVID, you're gonna have to definitely get creative. Once we're kind of out of this and hopefully get back to some sort of in-person normalcy, definitely going to the different oh my gosh, like the different conventions is that what they're called, conventions? Conferences, thank you. I'm like, what is that word? Oh my gosh, yes, the conferences. I was like, that didn't sound right, conventions. So the different conferences, I used to love going to those. I was all about the events when, outside was open. So once it does open again, go to them for sure.
Awesome. We only have time for a couple more. This is a great one. Did you continue to travel when you were in NP school?
I wasn't travel nursing when I was in NP school. That was afterward, while I was studying to be to pass my NP boards. I worked as an NP for a short period of time and actually went back to travel nursing for a little bit before I found my job now. So that's another thing. If people are asking, you can definitely flip-flop and go back and forth. Once you become an NP, you still have to keep your RN license active, so you can definitely still work as an RN if need be. So yeah.
Absolutely. I have a lot of friends who are actually in NP school right now, and their first year, some of them are still traveling. But I think once their clinical start their second year, they're on various programs. They're no longer going to be able to travel, I think.
Yeah.
It's doable, but I think it's really specific to whichever program you're in. And then we have time for one more. And so sorry, guys, we're not going to get to all the questions. Last one is going to be, are online programs looked at differently than in person when it comes to jobs or opportunities?
Not that I know of. As I said, when I went on my interviews, the only time they really brought up the school was just because they were like, oh, Hopkins, okay. And then they just move on. Like it wasn't, they didn't really talk too much about it. But then with that being said, I'm a little biased because I did go to a pretty namesy school like Hopkins. So I don't know if it would be an issue, but I haven't noticed that at all, really. I haven't heard anyone saying, oh, I wasn't able to get a job because I was in this program or whatever like that. So I would say you're probably okay.
Okay, awesome. Well, thank you for answering all those questions, Ashley.
Yeah.
Thank you everyone for joining us. I'm gonna pass it off to Nicole real quick.
Yes, when I can find the unmute button. Thank you, Ashley. This was so much good information. As I mentioned in the chat before, I will wrap all of this up and send it off to everybody within the next 24 hours or so. So feel free to rewatch, take notes, all that good stuff, and share it with your other nursing family and friends who may also want to be going back to school. So thank you all for joining. Thank you to Ashley, and keep an eye on your email for future events, as well as to give us some feedback on how you think tonight went and any other ideas you have for future events and improvement. Thank you all. Good night.
Bye, guys.
Bye, everyone. Take care. Stay safe.